As parents, we all want our children to be happy and healthy, but sometimes mental health issues get in the way. And we as parents need to educate ourselves on how to help our children. Hello, and welcome to Living Well with Robin Stoloff, empowering you to live a healthier life. Today, we're going to address the issue of mental health in our children. And joining me now is Dr. Eugene Horshorin, professor of clinical pediatrics at the University of Florida School of Medicine in Jacksonville. He's also part of the faculty of the Reach Institute. Thank you so much for joining us, Dr. Horshorin.
Thank you. Happy to be here.
This issue really came to light after or during the pandemic when we saw our children isolated from their friends, isolated from school, and we really put a spotlight on mental health and our kids. But it was happening way before that, wasn't it?
Sure was, yeah. So we knew that, for example, 20% of kids in the United States before the pandemic had a mental health issue, a diagnosable mental health problem. And out of that 20%, only 20% of those were able to get treatment because there just aren't enough people trained to take care of kids with mental health issues.
What are the most common mental health issues we see in our children?
Well, the three most common by far are ADHD, depression, and anxiety.
I'm just going to be open and honest. My daughter has ADHD. She was diagnosed at a very young age, and it's been a struggle for her, especially in school, especially with math, which many people struggle with anyway. And it's been very, very difficult, but we're working with her. We have her on some medication, but it is a lifelong issue. And anybody who's ever experienced it understands what it's all about. Many adults have it as well. What can we do as parents to recognize the issues, the serious issues in our kids that require some help?
Well, it really depends on what the particular issue is. If it's ADHD, it usually comes to our attention through the schools because of either underperformance or behavioral issues. If it is more depression or anxiety, it's usually changes in behavior, changes in mood that parents recognize. And what can they do? They need to recognize it and get it to the attention of their pediatrician, who can then either begin to assess and treat or refer them to the appropriate people who can do that.
How do you know if it's just a kid who's feeling a little down? And when we say kids, it could be young kids, it could be teens, all ages. How do you know if it's just they're just a little down, they had a fight with a friend or something didn't go right, or if it's really serious depression or anxiety? How do we know the difference?
When you see it beginning to affect how they're functioning within their life, that's when you know that there's a problem. Whether that's affecting their functioning in school, affecting socially, affecting sleep or eating, but when it becomes to impact their life in a negative way, that's a problem serious enough that it needs to come to the attention of a clinician.
Absolutely. And I always read stories and I always hear stories about a child who has either attempted suicide or actually completed suicide. And it's just a heartbreaking thing when you think about if possibly you might have recognized something in that child ahead of time, you might have been able to prevent it. And I'm sure that has to haunt parents over and over again. And I think about that in my own children. I want to be able to recognize any kind of problem so you can address it up front.
I agree. Anytime you see a significant change in the behavior of your child, you have to take it seriously. And agreed, sometimes it's just maturation, it's a change in friends or whatever, but sometimes it's something important that needs to be addressed.
Absolutely. And you're right. We don't want to let it go and just shrug it off. And sometimes we are busy as parents. We're doing a million things. We're driving our kids here and there. We're busy with our jobs. We don't always recognize it. And that's why I think it's great now. I just took my daughter, we went to the pediatrician together. She's 19, but she's still with a pediatrician. And she got a tablet with questions on it about her mental health. And I thought that was great. At least it's something. It's some kind of screening where if they answer certain questions, they're going to take it a step further. And that's been what, over the last several years that that's been instituted?
Yeah, probably the last 10 years or so for
Hmm.
depression. And now there's a recommendation from the same United States Protective Task Force to look at anxiety as a screen for all children at this point, too. So we're starting to recognize that these numbers are going up of depression
Hmm.
and anxiety. And now we want to screen for them so they can be picked up early by your pediatrician at well visits.
And when the pediatrician picks it up, the next step is to refer to a professional.
Well, there aren't enough professionals. That's the problem.
Yes.
As I said, only 20% of these kids are getting treated because there just aren't enough psychiatrists and developmental pediatricians and psychologists to deal with 20% of the children in the United
That
States.
is true because I remember having to wait for appointments. Sometimes they were covered by insurance, sometimes they were not covered by insurance, and that can be
Right.
quite costly to a family if they're just
Absolutely.
trying to make ends meet. So
And that's
what does a parent
exactly,
do?
well, that's exactly why the Reach Institute came about. The goal was to bring the most up to date, evidence based treatment to as many children as possible by training primary care clinicians to know what to look for, to know how to assess for these problems, and then how to begin treatment for these problems. That's the whole goal of the Reach Institute.
That is amazing. And what kind of trainings do you have for these doctors and professionals?
So there are a number of programs that the Reach Institute puts on. The most popular is what we call the PPP program, and that's where we take primary care clinicians for pediatrics for children, and we actually teach them over a 3-day weekend everything they need to know to be able to assess, diagnose, and begin treatment for these kinds of problems that you and I have just been talking about. And then they spend 6 more months on group phone calls learning how to use those skills so that by the time that 6 month period is over, they're really good and comfortable taking care of these problems. And we've trained thousands of pediatricians now across the United States to be able to do that. And that's just one of the programs. We're teaching pediatricians how to do cognitive behavioral therapy for anxiety and depression. So that's a relatively new course. And there's a course for parents called the Parent Empowerment Program, which is a 5-day course where we actually teach these parents how to advocate for their children, how to advocate through the school system, how to advocate through their insurance policies. We're working with them to make sure they know how to get the help for their children that they need.
That is tremendous because it can be such a difficult system to navigate. And most people don't know even where to start. What do I do? How do I access care for my child?
Right?
So, how long have you been training physicians and how do you have any numbers or statistics on how it's going?
So yeah, we've been doing this since about 2006. So
Hmm.
it's been about 16 years. And we've actually trained 5,700 primary care physicians to be able to take care of these problems in that period of time.
Do you see that they're finding more children who need help through these programs?
Absolutely. We've got statistics and data now that we can look to see not only have we trained them, but are they actually using the training? Are they actually taking care of these children and making a difference? And the answer is absolutely. The number of children who are able to get care now that couldn't before has risen in every one of the areas where we've trained these people.
How can you get more pediatricians on board with this? That's a lot of pediatricians, but that certainly is just a small percentage of the number of doctors that are out there.
Yeah. And I want to emphasize we don't just train pediatricians, we also train nurse practitioners and PAs. So
Hmm.
we're trying to get this across to everybody who cares for children and does primary care work. And we're trying to make this as easy and as accessible as we possibly can. We're working with the American Academy of Pediatrics to get this message across. We're working with the American Board of Pediatrics so that the courses we offer actually get them the credit hours they need to maintain their license and their board certification. So we're really trying in every avenue we can to make it easy and desirable for them to want to do this. And actually, the American Academy of Pediatrics has come out with a policy statement that they want mental health integrated into all primary care practices. So it's really being pushed.
It's about time. I have to say, it's funny because I've been doing this for probably more than 30 years. God, I'm really aging myself here, but I had a different view of it when I first started. I thought mental health, oh, come on, just get over it, just like many people still do. Oh, snap out of it kind of thing. Good, great advice if you could do it, but a lot of these kids can't, a lot of adults can't. And why is our physical health given more weight than our mental health? It should not be. We're one person and both are important.
So of course I agree with you.
Of course.
But if you go
Yes.
back in history, mental health, back in the 40s and 50s, it was unacceptable to have a child with a mental health problem. You never talked about it. You never brought it out into the public. And it's only really in the last 20 or 30 years that, having ADHD, having a learning disability, having depression has been acceptable. So now people can talk about it, we can get numbers, and we can begin to address it. So it's been sort of taboo in the past.
Yes. You know what has really helped with that is the one area where I can say social media has helped. There are celebrities, there are people that others recognize and look up to that have come out and said, I have this issue, I have this problem. It has become acceptable. And they are helping others when they do that. Because when a kid sees somebody that they admire, a sports figure or an actress or actor, they say, oh my gosh, if that person could have it, then, it's okay for me to talk about it too. So it is changing slowly but surely.
I agree. Social media has its pluses and minuses, and you're right. The fact that we can see famous people, as you're saying, coming out with their issues, makes it more acceptable.
Absolutely. And while we're on the subject of social media, because it's one of my pet peeves, because I pretty much just see the top of my daughter's and my son's head, when they're always looking at their phone. How does that affect a kid's mental health? Because it can be a great connector with other people. And then I also feel as if I see, I just visited my daughter's college and I saw all these kids sitting by themselves at lunch on their cell phones. And I'm thinking, why isn't anybody sitting together? Few kids were, but there was a lot of kids sitting by themselves looking at their cell phones. And
Texting,
yeah,
right?
yeah. Who are they talking to? Why aren't they talking to people right next to them? And it's so different from when we were younger. We didn't have a choice. We didn't have cell phones. We had to talk to people. And I am not a clinician, but just from my observation, I feel like that affects their social skills.
Well, there's some data beginning to come out that it does affect social skills. It affects language skills, with all the abbreviations, and the kids
Yeah.
are not using language the way they have in the past. There's a lot of cyberbullying going on, which
Yes, yes.
depression and anxiety, because it's so easy, it's so impersonal. You think you can do whatever you want, nobody will ever know.
Oh,
And
and there's
and
been some
so
tragedies that have occurred because of that.
absolutely. So there, you mentioned some positives, but there are definitely negatives to social media affecting our kids in many, many ways. Video
Absolutely.
games, for example,
Yeah.
they're all about short-term reinforcement, short-term, uh, uh,
Gratification. Yeah.
gratification,
Hmm.
exactly. And so, kids don't have to postpone gratification. It's everything about now and short
It's
term. And
immediate. Yes.
yep,
Yes, that is so true. It's really can be a problem. And I think just to get this out here, as much as we can, it's hard to, tell your kids not to use it, but we do have to set some limits. We have a no device rule at the dinner table. And even my son, he'll try to sneak it under the table. You're not a doctor. You're not going to, it's not an emergency. You can put your phone away, and just talk to your family. And at least we've tried to do a little bit like that. And my daughter, when she's on her phone all day, I'm like, that's enough. Shut it down. Do something else because and adults too. I mean, it's become almost, I hate to use the word addiction, but I think it kind of is.
And I'll tell you that the American Academy of Pediatrics has come out with a policy statement saying that children should not have more than 1 to 2 hours max of screen time during the day. That includes video games, television, texting, social media.
That's just
One
the
to two,
morning. That's just the start of the day.
yeah,
I
but that's
mean,
what
oh
they're
my
recommending.
goodness.
And they're saying no televisions in your room. That if you got to force the child to come out of their room to be entertained.
Yes. Well, anymore, I find kids don't even watch TV. You could have a 60-inch TV and they're on their little tiny screen on their cell phone. That's kind of what they do now. But it really is, it's a problem. And we as parents, I think, kind of reinforce that because our heads are in our phones as well. So it's really something that all of us should be more aware, and myself included. I'm including myself in it.
How many times have you been in a restaurant and you see a couple sitting at the table and they're both on their phones, not talking to each other?
And families. I've seen
Yeah.
two kids and two adults, and they're all sitting there on their phones. That's kind of sad in a way. What we need to do, I think, is connect again as people. And I think we lost a lot of that, boy, over the pandemic. We really were apart from one another. And now we have an opportunity to start getting back in person again. And I don't know how everybody else feels. It took me a little bit to make that transition. When things started to open, I got a little lazy. Oh, we can just do it on Zoom and we don't have to get out of our sweatpants. And I don't know if other people are feeling that, but I think that's kind of happening
Well,
with
for
kids
chil
too.
for children, it's been even more than, you described it as lazy. It's more than that because they went through this pandemic where they were told it's dangerous to go to school, it's dangerous to be
Hmm.
out in stores, and then the pandemic starts to calm down and they're terrified to be back in public. They're afraid to go back in school. The amounts of anxiety since the pandemic started, it's estimated to have tripled in children. And
I did not
so,
know that. That's incredible.
yeah. And so the pandemic has really set us back in many ways. Reading levels have dropped in kids since
Test
the
scores.
pandemic.
Yes.
Absolutely. So it's affected our children in so many negative ways.
And we as parents, we are their advocates. Who cares about our kids more than we do? So we need to really educate ourselves about these issues, about the symptoms, what we can do to help them. And I'll tell you what, the Reach site is terrific, the Reach Institute. I was on there looking around. You have a lot of great information.
We do. There's a lot of tools, there's a lot of reading material. And just if you're looking for that information, it's thereachinstitute.org. And there's a lot of materials there that parents can educate themselves on how to advocate for their kids, how to recognize things.
Yeah.
And then, they can get more information by participating in one of the courses if they're interested in learning more.
Yes, it's great. You can sign up for the newsletter and the blogs. I mean, there's just a ton of information on there. It's such a good resource. And again, what is that website?
It's thereachinstitute.org.
Just such good information. Thank you so much for sharing. It's really important for all of us to be much more aware, and hopefully, we've made some impact out there. That's the whole goal of this. So, thank you.
You're very welcome, and thank you for allowing us to get this information out.
It's my true pleasure. It really is. As a mom with a child with some special needs, it's really important to me, and I'm sure it's important to many parents who have kids that need a little extra help. So, thank you, Doctor.
Very welcome.
Dr. Eugene Horshorin of the Reach Institute. And thank you for being with me today for Living Well with Robin Stoloff, empowering you to live a healthier life. Hope to see you again next time.